so we'll have a look at the neck. So tight up through there, tight through that upper trap on the right. This is what I'm looking for, this pec in there. So you can actually see with Dan, he's got anterior rotation of those shoulders. That's going to make his shoulder not function properly in its normal movement, but also in its resting state. We're going to find a whole bunch of stuff through the back here. So in through the dumai, tight through there, feel that?
Yep.
Yep. And we're tight through the bladder channel and the outer bladder channel. You need to get some treatments, Phil.
I do.
Then I'm going into dumai in around T7-9, going out to the bladder channel, down to the lower back bladder channel, L5S1. That's not too bad. Yep. SI joint, hips not too bad. It's a little bit in there. ITB, just the inside of the legs, back, calves. So yeah, inner bladder channel, outer bladder channel, both tight. Yep, really tight through here, around that sort of T9 region on the bladder channel.
It's a motorcycle accident.
The good old days, eh?
Mm-hmm.
Yeah.
And
TFL's tight. Is this the hip? Yeah, okay. He's got a dicky hip. All right. And what you can do as well, if you want, you can add in abdominal palpation. This is probably a cornerstone of the neoclassical approach. I don't use Slate's diagnostic approach. I'm just using this as a template to be able to go check there, check there. I just checked 3 spots. All I'm looking for is are there any tight spots? Because I can use that as a template in terms of, rather than go back and palpate where it's sore time and time and time again, which is going to make it sore, more inflamed, I can use some other parts of the body as a guide and then go back to that shoulder towards the end. Does that make sense? Yeah, all right. So I'm going to use one of my favourite points, liver 4. So my liver 4 is through the tendon. So Dan's got a really nice pronounced tendon through here. And all I do is squeeze either side of it and just needle. Do you want to, can I do that another way? Do you want to bring that around? Mm-hmm. So I'm just needling straight in there. Is that okay? Feel all right?
Yeah.
Yep. Cool. All right, so angle's a bit off, but that's all right. I'm sorry, do it.
Yeah,
that way.
That's fine.
And then I'm going to come back and check. I can use his abdomen if I want to. I don't have to. And that's different. Feel the difference? Yeah. It's not as much as I'd like. So all I'm doing is I'm coming back and I'm doing what I call sitting on the needle. And again, we'll go through this. Yep.
Yeah, after just any change, or you're not asking about his primary complaint anymore? Straight off?
No. Yeah, not now, because his primary complaint is sore, and if I go back and palpate that and get him to keep moving it, then it's going to be more sore. There'll be a bursitis thing going on here. And these can be really tough to treat. Has anyone nail frozen shoulder every time, first time? No, I don't know anyone that does. Mate of mine who's a body worker, yeah, feel the difference? Much softer.
Gurgle there.
Yeah. Mate of mine who's a body worker, used to teach at VUT, like a world-renowned body worker and teacher. Even from his perspective, it's a minimum 3 months before you see a solid change in frozen shoulder or pre-frozen shoulder even. So this is kind of like possibly a pre. And feel the difference?
Yeah.
Yeah. Not as much as I'd like, nowhere near as much as I'd like. So I'm going to just shift that a bit. The angle's not right for my liking.
So how much change would you expect out of one treatment?
I want minimum 50% change.
50% of what?
50% of the main complaint. Yeah.
And the abdominal?
Abdominal is just a test point. Yeah. I want the main complaint to be minimum 50% improved. Most of the time it'll be maybe. With a shoulder, probably, 50 or above. Frozen shoulder, speculative. Okay, yeah, feel the difference?
Yeah.
Yeah, cool. And that upper trap, feel how that's starting to come off?
Yeah.
Yeah, and feel how that's come off?
That's better.
Yeah, all right, so let's have a look now through the back. So that Dumai's moving better, would that be right?
Yep.
Yep.
No pain.
And that bladder
It's
channel's
better.
just heaps better.
Yeah.
And so is that one.
Yep.
Yep, cool. All right, so the other key points that we picked up, I would recommend for you guys to palpate more of the body more of the time. I'm just going back to the key spots that I identified. But for you guys, if you're not used to palpating, keep going through and do it as a pattern. Start at the neck, hit the shoulders, do the pecs, work through the upper thoracics, mid thoracics, lower back.
Do you always palpate face up?
Yep. And that's heaps better. Yep, all right. So let's see if we got his hip. That mid, still a bit tight in there, isn't it?
Yeah. it's
Okay.
better.
So old motorbike accident. Dr. Tan used to always say if they've had structural change, it's a lot harder to treat. Yes and no. I've had people with really wacky things that, they've had massive structural damage and it works really well, really quickly, and then others it doesn't. So it's... But normally I would expect like 90% of my clients, as a baseline, I'm getting really significant change in the treatment. Now, as you would expect, if someone's had something for a long time, it's going to come back through the week, right? All I want to do is I want to make sure that when they come back in, they're better than what they were than the previous time. So if we're doing that, then we're starting to move ahead and build momentum over time. For me, I consider acupuncture is very much around a cumulative effect, and so a compounding effect. Over time, four treatments is going to be the equivalent of like 6 or 10 in terms of its effect. Does that make sense? Yeah?
Yeah.
Yeah, feel the difference?
Yeah.
Awesome. And that's much better
So
too.
it's a lot better.
Yeah.
That's really good.